This is audio lecture 1 for cardiorespiratory fitness. What is the cardiovascular system? The cardiovascular system serves two main functions. The first is that it pumps the blood, and this blood comes from the heart, and then it also carries the blood. So it carries our blood to arteries, veins, and our capillaries. Our arteries carry our oxygenated blood away from the heart to the body's tissues. Our veins carry the deoxygenated blood back to the heart, where then it gets reoxygenated between our heart and our lungs. And then our capillaries are our smallest blood vessels in the body. And their main function is to exchange materials between the blood and the tissue. But they're tiny vessels that also connect our arteries and our veins. So our capillaries are imperative to the system continuing to work. What is cardiorespiratory fitness? Cardiorespiratory fitness reflects the functional capabilities of the heart, blood vessels, lungs, and skeletal muscles to perform work. It's also the ability of the cardiovascular and respiratory systems to supply oxygen to the muscles to perform metabolic work, and serves as an indicatory of functional capacity. Cardiorespiratory fitness, sometimes abbreviated as CRF, is often considered one of the best indicators of the collective health and function of the entire body and a vital sign for cardiovascular health. Cardiorespiratory fitness provides the ability to perform large muscle, dynamic, moderate to high intensity exercise for prolonged periods. There are many different terms that have been used to describe this measure of physical fitness. Some of these terms are used interchangeably, but they include things like maximal aerobic capacity, aerobic fitness, cardiorespiratory fitness, functional capacity, physical work capacity, cardiovascular endurance, cardiorespiratory endurance, and cardiopulmonary endurance. When we're looking at cardiorespiratory fitness, also referred to as aerobic fitness, it refers to the ability of the cardiovascular and respiratory systems to supply oxygen to muscles during sustained physical activity. Our VO2 is our measure of oxygen consumption, which is a key measure of cardiorespiratory fitness, and it reflects how effectively the body uses oxygen. CRF is regularly performed in both healthy and clinical populations. Cardiorespiratory fitness is measured through our VO2 consumption at rest. It can be measured submaximally and at maximal exertion levels. When we're assessing our VO2, we have two different variables we can get. We can get our absolute oxygen consumption, which is our VO2 times our liters per minute, so the top equation, or we can get our relative oxygen consumption. Our relative oxygen consumption also takes into account our body weight, or the second equation. Another way we can represent cardiorespiratory fitness is in METs, or metabolic equivalents. METs are a way to express exercise intensity, where 1 MET equals 3.5 milliliters per kilogram per minute. So 1 MET is equal to a VO2 of 3.5. I know this isn't an exercise physiology class, and you've probably seen these equations previously, but I want to just go over them briefly. So if we had an individual who had a VO2 of 2.3 liters per minute and a body mass of 83 kilograms, what would their relative VO2 be? So if we plug it into the equation that we've been given, we would get a relative VO2 of 27.7 milliliters per kilogram per minute. Okay. If we assume that they have a VO2 that's being used for cycling at 15 miles per hour, and that is 42 milliliters per kilogram per minute, what would the VO2 be in METs? So remember that 1 MET equals 3.5. So we would take VO2, our number in the equation, divided by 3.5 to get our 12 METs. If running at 15 METs, and we wanted to correspond that to a VO2, we would take our 15, multiply it by our 3.5 to get 52.5 milliliters per kilogram per minute. Again, I'm not going to make you do these equations. I just wanted to briefly review how we convert and calculate our VO2 in relation to our METs. If we look at this chart here, cardiorespiratory fitness is often categorized based on VO2 max, which represents the highest rate at which an individual can consume oxygen during intense exercise. If we look here, we can see different VO2 max amounts relative to fitness levels. Cardiorespiratory fitness has several uses. First, it can be used to provide motivation for a participant considering participation in physical activity or exercise programs. It can also be used to individualize the exercise prescription and to track progress within an exercise program. Another important value of the assessment of cardiorespiratory fitness is that it directly relates to the participant's functional status. This can be demonstrated in part by comparing, let's say, a 45-year-old woman with high cardiorespiratory fitness, for example, being in the 85th percentile, to another 45-year-old woman with low cardiorespiratory fitness, for example, in the 15th percentile. The woman with high cardiorespiratory fitness can easily perform occupational and recreational activities. These can be things such as carrying groceries upstairs, riding a bicycle at 10 miles an hour, shoveling snow, or playing singles tennis. The woman with low cardiorespiratory fitness will only be able to perform these same activities, if at all, with maximal or near maximal effort and will fatigue quickly. Cardiorespiratory fitness can also aid in making occupational and disability determinations, as well as aid in return to work determinations. How do we assess cardiorespiratory fitness? The gold standard measurement for cardiorespiratory fitness is the maximal exercise test with a collection of expired gases. You guys have probably done some of these in previous classes. These gold standard tests are performed in a laboratory setting with trained personnel and require specific monitoring equipment. Because this method involves time, cost, and skilled personnel, as well as a higher level of risk, it's not always feasible or desired for every person. It should also be noted that maximal exercise testing is also performed in clinical settings for both diagnosis and prognosis purposes of some chronic diseases. That could be something like certain stress tests and things like that. Fortunately for us, there are many alternative approaches that provide estimates of cardiorespiratory fitness using submaximal protocols following established field or laboratory tests. Luckily for us, even though the gold standard tests have less error and are more accurate, we can still get good approximations from field tests. Field tests are usually done in a non-lab setting. Many field tests originated from the need to assess cardiorespiratory fitness of a large group in a time-efficient, non-laboratory setting. Field tests have several advantages over lab tests. Some of those include that they don't require highly trained personnel to administer them, They're time efficient. You can test many participants in one session, and they're inexpensive or require little, if any, equipment. Unlike our lab-based tests, where we're looking at the gases that are being exchanged and the equipment that's required, these field tests are more easy to administer in a more informal setting. Generally, field tests are considered safe to perform. However, this may be because they're typically used in younger, lower risk populations. It's important to recognize that some of the tests, such as running 1.5 miles as fast as possible, will result in the participant doing maximal or near maximal levels of exertion. So this requirement may be inappropriate for participants that are at a moderate to high risk for cardiovascular or musculoskeletal complications. We always want to perform a screening procedure on all participants prior to any cardiorespiratory fitness assessment, and following the personnel recommendations for supervision are thus warranted. That's why we make you, for this class, do the PAR-Q prior to us doing any sort of lab testing, that is our screening tool for this class. These are some of the additional screenings that we need to include prior to somebody doing cardiorespiratory fitness evaluations or field tests. If a participant has one of these, they can be at greater risk for harm, so we definitely want to take these into consideration. The first is for men if they're 45 years or older, or 55 years and older for women, have a family history of a heart attack or sudden death before age 55 years old in male immediate family, and 65 years for female. So if a male in their family died prior to 55, or a female died before 65 suddenly or due to, or they had a heart attack. Cigarette smoking, or if they've quit within 6 months. This includes e-cigarettes, vapes, things like that. If they have hypertension, or are currently being medicated due to hypertension, if they have dyslipidemia, prediabetes, obesity, or sedentary lifestyle. These are all risk factors that we need to take into account prior to administering these types of field tests. Just like the risk factors on the previous slide, a health screen such as this or the PAR-Q Plus should be completed prior to exercise. This specific screening gives us some recommendations for whether they need medical clearance or some guidelines in terms of recommended intensity based on their current health history. This is a continuation of the screening on the previous slide. The previous slide were for participants that don't regularly exercise. This is the chart or the flow sheet for those that do regularly exercise. So ideally, these would be on the same page, but for display purposes, they had to be separated. This is just the key for all of the symbol codes from the previous 2 slides for that flow sheet of participation. We can also use the PAR-Q as a screening tool. This is appropriate for people between aged 15 to 69. You should be pretty familiar with this. You had to fill it out earlier this semester for this class and have probably had to fill it out previously. But again, some sort of screening needs to take place prior to assessing cardiorespiratory fitness. This is the end of part 1. In part 2, we will talk about the specific field tests to assess cardiorespiratory fitness.